In this video, we will explain the relationship between metastasis and cancer staging for solid tumors. We will introduce a standardized staging system for cancer known as the T&M cancer staging system. We will then describe each component thereof and end with showing different examples of various solid tumors using the T&M scale. If you would like to review our lesson on how does cancer spread, which covers the whole metastatic process in greater detail, please consult the links available below. Cancer staging is a way for doctors to describe the size and spread of tumors. There are several systems for grading different types of cancer, but one of the most widely used is the T&M staging system for solid tumors. T&M stands for tumor, node, and metastasis. It is a standardized scale that provides a detailed description of how far cancer has spread. This system helps doctors understand how aggressive the cancer is so that they can plan the best treatment and assess a patient's prognosis. Now let's break down the T&M system to learn what each part represents. T stands for tumor. This refers to the size of the primary tumor, and tumor size is usually measured in centimeters and can have a value ranging from 0 to 4. T0 means that there is no evidence of a primary tumor, and when a primary tumor is present, T1 to T4 indicates the size of the tumor. For example, T1 refers to a small localized tumor, while T4 indicates a large tumor. T4 tumors may be so large that they have grown into nearby tissues. When looking back to the metastatic process, we can now see the T describes features of the primary tumor as well as the local invasion status. N stands for nodes. This describes whether the cancer has spread to nearby lymph nodes. Lymph nodes are small bean-shaped structures that are part of the body's lymphatic system and can have a range from 0 to 3. N0 means no regional lymph node involvement, whereas N1 to N3 indicates increasing involvement of lymph nodes. For example, N1 might mean a few cancerous nodes close to the tumor, while N3 indicates more extensive lymph node involvement. M stands for metastasis. This indicates whether the cancer has spread to other parts of the body and can only have one of two values. M0, which indicates that there is no metastasis, or M1, which means there is metastasis present, indicating that the cancer has spread to other organs or distant lymph nodes. Looking at the metastatic process again, we can see that the M is related to the formation of secondary tumors. Let's look at some examples of various tumors and their characteristics related to their T&M staging. Example 1. T2N1M0. T2 indicates the tumor is moderate in size and has grown to nearby tissues. N1 means that there is some cancer involvement in nearby lymph nodes, and M0 indicates that there is no metastasis. Example 2. T4N3M1. T4 means the tumor is large and has grown extensively into nearby tissues. N3 shows that there is extensive lymph node involvement, and M1 says that the cancer has spread to distant parts of the body. Now try this example on your own. What is the characteristics of this T&M classification? T3, N2, M0. T3 indicates a large tumor. N2 shows moderate lymph node involvement, and M0 means there is no metastasis. Now that we understand how the T&M system works, let's identify which cancers can be graded using this method. As mentioned earlier, this method is mostly used for solid tumor cancer cases, and the types of tumors that are graded using the T&M system include breast, lung, colorectal, prostate, head and neck, esophagus, and lastly, melanoma. We should note that not all cancers are graded using the T&M scale. These cancers may use unique staging systems that are tailored to their specific characteristics. Leukemia and multiple myeloma are examples of blood cancers, which uses their own unique staging system. To highlight some of our summary points, The TNM system is an essential tool in cancer diagnosis and care that offers a standardized way to describe the progression of the disease. By breaking down the components of tumor, nodes, and metastasis, doctors can tailor treatment plans and provide better care for their patients. If you enjoyed this video and would like to learn more about molecular pathology and cancer, please take a look at our online catalog.